Hi there, this is Dr. Sean Hill here at Lone Star Plastic Surgery in Frisco, Texas. The topic of today's video is the recovery process for a tummy tuck, also known as an abdominoplasty. As always, these are my particular post-operative instructions. You should always consult your own particular surgeon's post-operative instructions, as each surgeon has their own particular plan and recovery process. This is just a guide for my patients as well as patients considering abdominoplasty surgery. The recovery from the tummy tuck is typically day surgery, though patients can stay overnight, and some surgeons may have their patients stay overnight. I do, depending upon a patient's comfort. Typically, it takes anywhere from 3 hours to 4 hours and is often coupled with liposuction of the love handles and the upper belly, sometimes lipo 360, which is the lower back as well. After surgery, you will wake up, you'll have an abdominal binder in place, which is a rubber band that goes across your waist to help control swelling. There will be little foam squares on the inside called top-of-foam. The top-of-foam helps provide uniform compression as well as to help pad the binder. The incisions themselves, your belly button will have a little clear sticker dressing on there called a tegaderm. Tegaderm is just, like I said, a clear sticker dressing. On the belly button itself, there'll be some yellow gauze called Zeroform. The yellow gauze are present. Every once in a while I do get the question of, is my belly button yellow? That is not your belly button, that is a Zeroform. On the incisions themselves at the bottom there'll be little paper strips called steri strips. Those will remain on until they fall off or until we see you back in the office. The tegaderm itself, I forgot to mention, can come off the next day after surgery and remove the little piece of Zeroform as well. You may or may not have drainage tubes after surgery. Drainage tubes are little rubber tubes that come out from underneath the incision. Those are designed to collect fluid to prevent fluid collections after surgery. Depending upon each patient's anatomy, you may have anywhere from 0 drains up to 2 drains. Drains themselves remain in until they're putting out less than 20 milliliters or cc's in a 24-hour period. Whenever you go home, you will be instructed before you leave the hospital how to take care of the drains. Essentially, you get a measuring cup that you don't care about. You empty the fluid into the measuring cup and write down how much comes out. And each time you empty the drain, this will serve as a guide for letting us know when the drain can come out. In the first few days, you may need to empty the drain several times a day. By the end of the time the drains serve its function, it'll typically be maybe once a day. You'll come into the office 1 week after your surgery. At that point in time, we will inspect the incisions, make sure everything's healing well, and then remove drains whenever needed. The one thing I forgot to mention is there are certain medications which we typically prescribe. One is for pain, another medication is for sleep as well as muscle pain. You'll be prescribed something for nausea as well. Depending upon a person's risk factors, you may or may not be prescribed a blood thinning medication. I typically reserve this for patients who are high risk for blood clots. We will discuss this during your consultation, and we will run a risk stratification system to determine your risk factors for blood clots. The one thing I do advise patients is you must get up and walk 6 hours after surgery, not necessarily around the block, but just around the house. Walking 3 times a day will help reduce the risk of blood clots. Most patients will be on pain medication for anywhere from 1 to 2 weeks. Most patients will take about 1 to 2 weeks off of work. In the first week, you'll be kind of hunched over, and whenever you walk around, you can straighten up whenever you feel like you're able to straighten up. I encourage patients to sleep on their back with their head elevated on some pillows, as well as some pillows underneath their legs. This helps kind of take tension off the wound to make you more comfortable. You can lay flat on your back whenever you feel like you're able to stretch out. Sleeping on your back is advised up to about 3 weeks after surgery. At 3 weeks, you can sleep on your side. After 4 weeks, you can sleep on your tummy. No working out for the first 2 weeks after surgery. As stated, I want you walking around the house 3 times a day to reduce the risk of blood clots, but keep your heart rate less than 110. Getting your heart rate above 110 does increase the risk of bleeding. After 2 weeks, you can start working out. You can get back on the Peloton, the treadmill. You can do upper body weights, lower body weights, but no core muscle exercises until 6 weeks after surgery. So after 2 weeks, your limitations are only the core muscle exercises. After 6 weeks, you can return to any activity you'd like. You can do any core muscle exercises. You can do CrossFit, you can do yoga, Pilates, all of those things. There are no limitations after 6 weeks. No swimming until 3 weeks after surgery. And keep the incisions as dry, as I said, until 3 weeks. No hot tubs or saunas, again, until 3 weeks after surgery. Scar care itself, for the first few weeks, you'll have, like I said, the steri strips on the incisions. We'll take those off during your post-operative visits. At that point in time, you'll put some Neosporin or Aquaphor on the incisions until 3 weeks after surgery. At 3 weeks, you'll begin Silogen scar gel or scar strips. This is silicone impregnated scar gels, which we do give as part of our recovery process. You'll begin that 3 weeks after surgery and continue that up until 1 year after surgery. The scars themselves will progress for the first year after surgery. They will lighten in color, they will thin, they will become softer with time. Again, this is Dr. Sean Hill talking to you about the recovery process for abdominoplasty or tummy tuck surgery. Thank you so much for joining us. Take care.